Western emailed us and they said that we're putting all the physical therapy students on a list.
Welcome back to our channel. Today we've got a special release for you. We've got another student story and a very special guest with us today. This is Julie. She has been a CSAW member for a very long time and she's been very active, and she's here today to tell her story of the challenges she's faced over the last few years at Western University. So welcome, Julie. Why don't you go ahead and do a quick introduction of yourself.
My name is Julie. I completed my first year in the physical therapy program at Western University for the 2020-21 year. I would be finishing up my second year, but circumstances have changed. I entered the physical therapy program after completing my undergrad in kinesiology and becoming a kinesiologist, but I was pretty thrilled to get into the physical therapy program because I really wanted a skill where I could help people even more than what I had with my current skills. So yeah, this is kind of the path I was hoping to take, and now it's on hold.
Mm-hmm. We know that you're facing a tough situation with the school that you're in for physio, right? Because you completed 1 year and you're kind of stuck in between a rock and a hard place going into your second year, and you don't know what you're going to do. So we'll get to that in a moment. But first, I want to get to know like what your experience was like going through university during COVID and how that was going on. So tell us a little bit about your experience in your undergrad degree.
I completed my undergrad degree in 2019, I guess it was.
So you completed your undergrad degree before the COVID stuff began?
Yeah,
and then you went into physio school as COVID started, essentially?
Yeah.
Okay.
So how was that? Did you have in-person classes? Because that year I had everything online.
Yeah, we all did.
Yeah.
Yeah, like our lectures, they were online. We did have a lot of in-person labs though.
Oh, you did?
It was, yeah, a mixture.
So tell us about the in-person labs. You're too dangerous to be in a lecture, but you're not that dangerous to be in a lab.
No, you cannot.
How was that deemed to be accepted?
Well, the way it works is that you don't spread SARS-CoV-2 when you're in a lab setting, but if you were in a lecture or if you were in a practice room after lab, that's when the virus just spreads like crazy.
It just flew wild.
Yeah.
But not during the lab.
No, the lab, you're safe.
Of course.
Yeah. Well, anyway, I think we're all pretty excited to actually be doing in-person labs. I mean, I didn't expect anything but to do in-person, of course, but at the same time, it was a little bit difficult because humans are social creatures and, you know, we would want to see people. I was really excited. I was like, this is going to be my cohort, you know, I want to know the people I graduate with, and like, you know, people would stop and say hi in the halls, and then they say, you can't do that. You know, you got to act like professionals and we don't want to spread COVID.
Oh, so. No, professionals can't talk in the hall.
No, not acceptable.
You're not allowed to get to know people that you work with.
So, like, you know, we just talk in the locker room instead because none of the instructors will come in there and check up on us.
Oh, good.
You know, it's just a bit of a different environment. Like, we're supposed to stay away from everyone except our lab partners, which is kind of hard because you sometimes end up with 3 people. So, like, it's a little bit uncertain because they're all terrified of spreading COVID and you just want to learn. And it's like, oh, don't go near that person. But one time we had it where I was like with my whole learning team, and then, you know, we had lab later on that day. They're like, everybody separate. I'm thinking, like, if they got COVID from me, like, they already got it earlier today. Like, it's just, and they want to disinfect everything, which is okay. But like, then we weren't allowed to touch certain things. Like, don't touch the spine because we're trying to palpate. And then they're like, because we can't disinfect the skeleton. And I'm trying to get my hands on everything. It's just, I don't know, it's a frustrating experience. I know that profs are constrained by the rules. I'm just saying, like, it's hard when you're in a physical therapy program, and the worst part was probably being in the labs. And they said, well, normally the labs are open, like, for practice, but then they weren't. And then finally they opened them up, like, well into October, I think. And then so we finally got to practice a little bit, but then, like, you could only have 8 people in this room and 12 people in this room. And I expect you to act like professionals and not have too many people in the room. And like, we're trying to practice our skills because these are what we have to do for our patients. And yet they're like, we don't want you to practice too much or open up the practice rooms, and it's really frustrating.
Well, the physiotherapy program is very heavily based on practice. It's hands-on. Mm-hmm. You got to treat people, you got to touch people, you got to be close to people. That's just natural part of what you do.
Yeah.
So it's just kind of like I mean, I don't feel safe being treated by a physiotherapist that does not have much experience,
no
because of
experience.
COVID, because they told them, oh, you cannot do anything because you're going to die.
So that's what I say too. You're getting a lot of incompetent people graduating.
Right. And that's the dangers we're facing from this situation, is that
Yeah.
people don't learn.
Yeah. How are you supposed to treat someone,
Yeah.
like does this whole not touching people thing carry into the workplace? I'm going to my physiotherapist, but you can't touch me.
It actually does. We had a prof that said we can do everything we need virtually.
What?
As a
Yeah.
physiotherapist?
I've never heard of physiotherapy virtually.
So like if I want to test your quad strength, I can just grade it like a 4 or 5 just by watching how you move. I'll just say, okay, I'm feeling it as you're extending the knee. Okay, yeah. Or maybe I'll like test your reflexes virtually, just kind of tell you when to kick out or.
So the prof was really convinced that you could teach and do physiotherapy online.
I don't think she thought it through about all the things we do. Like I was saying, like obviously you're not going to be testing your quad strength virtually. You're not going to be testing your reflexes virtually. But that's what I'm trying to say. Like it actually is ludicrous. And I know physio is a lot of education, but it's also hands-on. I'm not going to do traction on you virtually. Okay, that feels really good, right?
Did you have any students in your program that questioned these things? Like, did people say anything like, are you crazy, professor? How do you expect us to learn anything online, let alone test patients and do all these things online? That seems a little far-fetched.
No one said anything. I was kind of upset when that professor said it, but I didn't say anything. What do you do?
People were just like, oh, well, I guess that's what we do now.
Yeah, you're just being professional and not questioning anything.
Yeah, that's part of being in school, I guess.
Nice.
That seems to be the common theme with our student stories, is that people just tend to not question anything. It's like, this is kind of ridiculous, but that's the world we live in today.
Yeah.
Oh boy.
Amazing.
We gotta fix it. We gotta do something.
Yeah.
So tell us a little bit about the time when the vaccination mandates rolled into Western University. I mean, Western University was so amazing because they were the first ones to introduce them, and they're so proud of the fact that they were the first ones to implement it.
And they've still got it. They didn't pause it for the summer.
No, of course not.
Of course not. They were the ones who started it. Why would they backtrack?
So tell us a bit about the time when this happened, and what did you experience?
I mean, I kind of saw them coming just before they came on, and I was watching like really nervously because I had a lot of questions about how we were handling this COVID and the vaccines. And it was actually interesting because my first encounter with them came in April earlier that year, because Western emailed us and they said that we're putting all the physical therapy students on a list to get vaccinated, and you have to email us and tell us if you don't want to be on that list.
Wow.
So they signed you up without your consent.
Well, but they said I could take my name off, which I did.
Okay.
Right, but they signed you up without your permission to do so. So if you didn't take your name off, you had an appointment.
Yeah, I know. I find that was a little bit forward of them.
Oh, just a bit. Just a tad.
So anyway, in August, I started seeing things. I first noticed how they made their students do it in residence. And then when the mandates came on, and I was just like, I think I have to step away for a year, deal with the issues we're facing. And I was also dealing with some health issues that were making it hard to participate in my program anyways. So I'm like, I think that's good a reason anybody say, like, look, I have to step back and deal with this. And I've been working with CSONT ever since then.
Awesome.
Yeah.
We're glad to have you
Yes.
on board.
So what has your involvement with CSONT been like?
I've been at a few Change My Mind events, and I do quite a bit of writing with the narrative changers.
So ever since you joined CSONT and you've been working with us on all the projects, you seem to be quite involved with the research about the ethics of the vaccine mandates being implemented. I'm just really curious about what you have to say about that, and what kind of research you found and what your particular perspective is on that.
One thing is the informed consent piece with these products are now. For one thing, they are in investigation. Also, when we're mandating them, we are telling people they have to take part in a product that doesn't have a lot of testing behind it. And if someone is okay with that, then that is their jurisdiction. But when a lot of people say, I want more testing, they say you have to you have to be part of this. And a lot of people in society are like, oh yeah, I'm fine with being part of, experimental product. And I'm like, that's not part of informed consent. It can't be coerced, and you aren't receiving all the facts about it either. And that's another thing. They're like, well, we can't talk about the risk versus benefits of the vaccine. Oh, we can talk about the benefits, but not the risks, because that would cause vaccine hesitancy. That is informed consent. I remember when I went to my surgeon, and before he performed the procedure, he's like, okay, you need to sign this consent form. And with this type of, if we do it this way, it will be a 2% chance of nerve damage. And if we do it this way, it'll be 0.5% chance of nerve damage. He didn't say, I'm covering that up. That is misinformation, because that will make you hesitant to get the surgery. I would hate to cause surgery hesitancy. That is called informed consent. And that is not what is happening here.
Yeah, you should have a right to know what could happen.
Yeah. And the other thing too, when they're forcing people to take vaccine, people need to take into account what's going on in their own body. They know what's best, and they have to make a decision for treatment or any kind of medical products, them with their healthcare provider, and that's a safe relationship. And the universities and employers are coming in and saying, we're deciding on the medical treatment, we're deciding what you put into your body. And I'm like, no, that's not how it works. And going back to benefit versus risk analysis, they're telling people, you have to take this COVID vaccine, but at the same time, there's no evidence for some people that their risk is greater than the benefit. So you've got people who are COVID recovered and naturally immune. So you have people who are in their teens and have a low risk from COVID. Well, they need to be able to say, okay, is the risk from the vaccine acceptable for the benefit I'm going to derive? And if they say, I'm going to take it, that is their jurisdiction. But when the university says, I get to decide, I'm like, well, that's not okay. Because like I said, you can't make your own risk versus benefit analysis. And then they're also telling the students, you have to do it to protect others, when we know it actually dampens your symptoms for the virus, but your peak viral load is just as high. And we know that the vaccines do seem to inhibit infection for a few months, but then they just dampen your symptoms, which also brings into the issue of, can you spread it asymptomatically? So we're saying, take it to protect others, but we're not really giving people informed consent about that, because a lot of people didn't realize that the vaccines weren't really sterilizing, right? So they're saying, I'm doing it to protect my grandma. I'm like, no, you do it to protect yourself. You can't take a treatment thinking that it's going to help other people. You know what I mean? That you take a treatment for yourself. So huge issues, not, like I said, a lot of it's informed consent, a lot of it's taking into account your own benefits versus risks, and nothing is being done that way. And that's a huge ethical concern.
Right. Well, the argument that typically the universities used to still implement it was that, it's still up to you whether you're going to take it or not. They're not going to come to your house and just jab you, but it's like, but if you don't, well, I'm sorry, but you can't be here. Mm-hmm. Right. And that's the issue there. So have you done any specific research on whether or not that's okay to be doing that? Because from what I understand is that is going to be, if somebody was to take the vaccine under that premise that, I'm just going to do it just to keep my place in the program that you're in, then they're essentially being coerced to do it. Yeah. Right? It's no longer informed, because they originally would have not taken it if it wasn't for that ultimatum.
Exactly.
Right? Is that what you're getting at?
Yeah, like for me, when I agreed to be part of the program, being part of receiving medical treatment was not part of, my original agreement, especially considering the investigational nature of these things. That's another huge ethical consideration. And then benefit versus risk analysis. And like I said, this is happening for people, like they say it's about health, but they're also kicking people out of online courses, which is obviously not about health because it's not a computer virus. So
you can't spread COVID through Zoom.
Your whole narrative kind of falls apart like that. You know what I mean?
Yeah. Yes. It's just they want everyone to comply, and everybody gets the consequences if they don't. I feel like this whole situation has caused a lot of distrust in the medical system.
Yeah. And I know some doctors speaking up and saying you're causing a lot of distrust, like you said, going to cause a lot of hesitancy for people taking vaccines in the future. I'm like, it's too late. Like, you've done so much damage, like that's irreparable. And I know a lot of doctors are in a difficult position because, I've heard some of them saying like, look, I could lose my license for saying anything against anything that's happening with this whole COVID management, but that's not okay too. Like, you're muzzling doctors, and how can we trust our doctors when they're not even allowed to give us what's
the
actually
information?
Yeah. So
wow, censorship within the medical field. Oh man, that's not good.
And it's not good because they're kind of creating a generation of fearful healthcare professionals too, right? Because you can't get into the healthcare system unless you comply with what they're doing right now. And a lot of people do have conscientious objections to what we're doing. So you kind of have to silence those. And then are you going to come into your profession years later and be like, no, now I can act according to my ethical principles?
Mm-hmm.
I mean, there are people who do that. I have heard some stories. But yeah, it's not just anyone who's being accepted to these programs either. Like, the physical therapy program is a really difficult one to get into, right? So how does that work? Like, you're someone who should have a decent understanding of what you're doing and should be able to do well in your practice, but they don't want to let you make decisions for yourself, and they want to control what you can do.
I know, and that's kind of ironic. I came into this program, I worked really hard, obviously, to get the marks to get into it, and they have probably room for 10% of their applicants. Wow. So it's something, like, I consider myself very blessed to be able to get into it. And now they're starting to say, okay, we've deemed you worthy to be educated as a healthcare professional, but now we're going to force you to accept medical decisions made on your behalf. And if I got out and practice, that wouldn't be okay either. It's like, I can't treat my patients like that, saying, I think that you should do this treatment to keep me safe or something. You know what I mean? So it's like all the principles that they're trying to teach me about ethics are being violated with their policies. And I find that very sad too, because they're supposed to be educating me.
Well, at the same time, this creates sort of a precedent for the other students who are going to be coming out of these programs. They think that it is okay to enforce something onto their patients in order to make themselves feel protected. But you could imagine the societal problems that we're going to encounter in the next few years is that these professionals, so to speak, are going to come out first, obviously with a lot less experience because they lived through COVID and they've lived through the restrictions when they cannot practice. And then second of all, the biggest issue is that they think that forcing your patient to do something is okay. Is that it's normal because they were forced to do the same when they were learning, right? And that's very concerning for our future. I mean, like, like what's the attitude like in the community that you're involved in the physiotherapy program? Like, I know it's typically a smaller program, maybe 50 to 80 students, but what's the feeling like between everybody? What's the feeling between the professors?
I mean, I didn't question them a lot about the vaccine mandates, naturally, because it came out and I ended up taking a leave of absence. I know there was one individual I practiced with and they mocked people who didn't want to take the vaccine, which I don't think was appropriate as a future healthcare professional, because whether or not you agree if someone wants to take a medical treatment or doesn't, even if you think that their benefit outweighs their risk, like making fun of people for not accepting a treatment is not acceptable in healthcare. And those are the people who we're allowing to go through. Those are the only kind of people. You basically have to, silence your convictions or else change your convictions and say it's okay to say, like you said, force medical treatment on people and, make fun of them if they don't want to receive it.
Man, no, it should be your personal choice.
Yeah.
It also should be a private decision. So, I mean, if your doctor is the one who knows your decision and they're the one making fun of you, that's pretty bad. But nobody else should know about that.
Yeah, I know. I only had one classmate who I talked to this a little bit about, and they said, that is your personal medical information. And I was surprised because, I just assumed that everyone who went along with, get the vaccine, like, okay, it's fine, it's your choice. But I assumed that they were all like, no, you have to disclose your personal medical information. So there are a few good people out there.
Okay,
still.
There's some hope.
Yeah.
It's not totally lost.
Yeah.
Thank God.
Yeah. So.
Okay, so what about the professors? I mean, in the professors in your field, they are healthcare practitioners, right? They are physiotherapists, I would assume. They have degrees in those fields. They treat patients on a regular basis. What was their attitude towards the restrictions, the mandates, the forcing of patients or their students to do things?
Well, like I said, I didn't talk to them really about the vaccine mandates. I know one of them had said, I don't know what the context was. They're like, oh, well, everyone will be vaccinated by then, won't they? And I just thought, I don't know about that. So I think some people were obviously very for the vaccines, which is, that is their choice. That's your medical choice. But like I said, I don't know. I think some of them would support it, but like I said, it's difficult to talk to them about it. It's kind of
it's a taboo subject.
Yeah, especially when you're in a program like this. I'm not going to go up to my profs and be like, I do not agree with your mandates based on the ethics of
it. But it's a health program. It's a science program. Science should be questioning these things.
That's how we do the science.
But not now.
No, you don't question. But it is really sad because I wonder how many of them were said, okay, I have to do it to keep my job. And if they didn't want to do it, and that would be really sad, but they were forced into it, so I don't know how they all feel about it. Or if you are forced into it, like a lot of people were, and they didn't want to take it, then how are they going to change their minds about it? Like they're going to say like, okay, I made that decision, and then they don't want to find anything more out about what was done to them because it was like they were psychologically damaged. Like I know people who were so upset about getting it, and that really grieves me that people were forced into it,
So tell us a bit about the situation you're in now. I mean, you said you took a leave of absence, right? Yeah. So when does that expire, and when do you have to go back to school, attend school? Because we know that Western has not lifted their vaccination policy.
Yeah, they're going to review it by September 1st, but I mean, who knows what they'll do? We could take some guesses, but...
So describe the situation you're in at the moment.
Well, at this moment, I'm on a medical leave of absence because I did have a lot of health problems. Normally, you don't just take a year off the physical therapy program. You enter in 1 year and you exit, in 2 years from now. So my medical leave of absence will be up in September, in which case I'll basically be re-enrolled, and I really love to go back to school. Unfortunately, I'm still struggling with some health problems that, that I'm off on the medical leave of absence for, but it's just, I think in the situation, I find it really ironic because I've been researching the vaccines, right? Because I think informed consent is very important, and I'm a little bit concerned now because some of the things that have been coming out about them, like the stuff about the autoimmune diseases, well, autoimmune diseases run in my family. So if people have been reporting autoimmune diseases after them, I don't want to do something that could trigger myself towards that. And like I was talking to someone in my family who, has a parent with some of those issues, and they're like, well, you think it's worth it to take a vaccine that could potentially exacerbate that issue? And I'm like, just so I can get a career? They're like, I don't think it's worth it, like your health. And then I think there's some of the side effects too. They tend to cause a lot of joint pain, and I know someone with similar health issues to mine, and they ended up with pain being first able to be controlled, but after the vaccine, not controlled. And I think obviously we know the vaccine exacerbates pre-existing conditions. So I think if you're already predisposed to them, you're going to be more likely to have those issues. So I think people need to make that decision, like, is this risk worth the benefit for me? And in my case, I'm looking at that and saying, like, look, I have some autoimmune, that's a serious condition. We learned about that in school. And the joint problems, those are just keeping me from completing my program at the time. So Western is basically saying, you have to take a treatment that could harm you. The results could be catastrophic. We really don't know until we try it. And if you don't, you can't become a physical therapist, which is ironic because we're supposed to be working with people with disabilities. And then you're saying you have to take a risk to your health. Otherwise, you're not allowed to work with people. And like I said, you can make your decision whether or not the vaccine is worth the risk versus the benefit. But I mean, I know I'm a COVID recovered individual. So at this point, it's pretty clear to me what my personal choice should be. And Western's like, no, we're not gonna respect that. You take that risk to your health, so you'll be deemed worthy to go through the program and help other people. Like, you're teaching me ethics?
Did you have an ethics course as part of your program?
Well, I took ethics a little bit in undergrad. I had to get ethics or take some ethics when I got my license to practice kinesiology, and I did do some ethics in the physical therapy program. Yes.
Okay, so tell us about the course there. What do they teach?
Did they actually teach ethics and there was just a lot of cognitive dissonance, or was it a skewed kind of curriculum?
Like, I think I learned about benefit versus risk a little bit in undergrad in my own study. They talked about ethics a lot about the patient-provider relationships and really listening to your patients.
Yes.
And although it was interesting, because I really picked up on that you need to listen to your patients to give them the best treatment possible, because if you don't know what's wrong, you can't help them. So that's kind of, right now they're doing it, and other people, they won't listen to people and say, like, they're saying, I think this treatment is best for you. And other people are saying, well, based on my medical history, I don't think it is best for me. And Western's just like, you don't listen to the students, we're just gonna say what's best for you. So I'm like, yeah, they're basically violating their own ethics principles in multiple ways.
That's another hypocritical loop.
Yeah, it's sad because like they're the ones who are preparing me to go out into the field, and just that they would disregard it at the level of higher education, and that, like, what does that say about our society?
Mm-hmm.
So you're kind of in a different situation from any of the students that we've talked to so far, because you are now thinking about what you're going to be doing going into next year. Are you going to go back to school? Are you going to try to extend your leave of absence? So what are you maybe leaning towards? What are the risks that you're facing if you do go back to school, and what are you facing if you don't? And I know that you have to do a placement as well. And that just complicates things even more. It's like, it's bad enough already if you're a student and you don't want to disclose your vaccination status and you just want to go to school, but it becomes so much more complicated for anyone in a program where they have to then go somewhere. And I mean, if you're in like a journalism program or something, you could do that virtually, although there are still complications with that. But like you would need to be in a clinic somewhere, right? You'd need to be with people.
Well, if we're operating on the same way we've been operating for the past 2 years, I should be able to do all my placements virtually, really.
Oh, right. What am I
thinking? Some students did have virtual placements. We felt sorry for them.
No
kidding. My God. Is that like a legit thing? I thought you were just joking.
No, last year we did not have enough placements for all the students, so some of them were stuck in front of a computer for 8 weeks. They ended up having to do an extra 2 weeks.
Wow. Okay, so not enough placement. That means not enough clinics have opened in person for like in-person appointments?
Clinics, hospitals, they just couldn't take enough students. So it has happened, and I don't think that I don't know if there are any guidelines or any hard, fast rules about how many of your clinical hours can actually be virtual. That was a question asked last year, and they don't know yet. So, but I mean, we can take a guess. I do have to do in person, and I want to do in person
because it's a better experience.
Hands-on program. So, and that was part of the reason, like, I decided with my medical leave of absence, obviously with the health issues, but also I'm like, look, it's not just Western that's implementing these policies. It's a lot of places, especially in healthcare. I've done my acute care placement like in a hospital, but I have to go into a rehab hospital again. They all have vax mandates to my knowledge. And then I have to do 2 placements in clinics. So the issue is there too. I can't just go and tell Western, I do not agree with your policy of vaccination mandate, because the fact of the matter is I need to get into the healthcare system through them too. And that's why I have to be open about this. This is the issue with the vaccine mandates, and I'm not trying to hide my status. So, I was thinking late last summer that, with the laws coming in so fast, like with the federal employee mandate, I thought something could happen in the province just within the next 12 months. And suddenly I'm stuck in the physio program. The law is the law, and I'm like, and they're just going to kick me right out. So I'm like, no, you've got to step aside right now. So I'm supposed to go back this fall, but my medical leave absence will be up, and even though my health problems are still resolving, I still would like to go back this fall, just because, you lack the continuity in your program and you already have to take a year off. So that's the thing. I kind of want to go back, even though I'm having health problems. But if they say you have to get the vaccine to get back, well, then knowing my medical history, I could have even more health problems when I get back, right? Then like, well, now what do I do? So, and I don't think they're going to say, look, if you can't comply, then you get a leave of absence. I'm afraid they're just going to be like, get the heck out of the program.
Mm-hmm. Right. So just put this into a little bit of context. You started the physiotherapy program in 2020-2021 year. So this is during COVID, yeah. Right? And you went through the full year studying that. Most of it was online, which was BS. And then afterwards, you took a leave of absence for a full year because of the vaccination mandates, and you were going through some personal issues with health as well. Yeah. So, and now you're faced with a situation where your leave of absence is coming up in September or in the fall, right? And you're going to be called back to finish your program because it is a 2-year program. So you've got to finish your second year. Now, with that comes a big issue because the vaccination mandate was never paused by Western University. Mm-hmm. And so Western is not actually we don't think Western is going to accept those students anymore. And you're kind of in a situation where you're debating if you can go back or you cannot go back. Are you going to work? What's going to happen? And that's unfortunate because your field is extremely competitive and you seem to be very dedicated. You seem to be very passionate about what you're doing. You really want to treat your patients. You want to do all these things. And Western just simply denying students their passion. And it's like you work hard to get there. It's really unfortunate what they're doing. But they are going to be, our society and our healthcare field is going to be stuck with students who don't know the ethics and who don't have practical experience. And they're going to be leaving students who are actually extremely passionate from the program. It's extremely unfortunate that you're faced these issues.
That's what I said. I'm like, those who question science, they will be gone. And that's the people we need in healthcare, not because I think I'm such an inherently talented person, but I'm just saying, don't tell me I'm not worthy to become a healthcare professional because I'm questioning what we're doing, because that is how we progress science. That's how we progress our care of patients. We ask the hard questions. We say, is what we're doing right? Can we improve what we're doing? We need patient safety. We need informed consent. And now that's completely taboo. That's not how we're going to prosper as a society.
Absolutely not. What do you want to tell to the viewers that are listening to this? Maybe you have a message for the rest of the people.
I would call on everyone, and this applies to universities, this applies to the government, this applies to everyone, to do what's right. We know how we ought to treat human beings. We know we have to treat people the way we ourselves want to be treated. And the way we're acting a lot of, I think, fear, and some people are acting in vindictiveness, and some people are just going along with it, and it's not okay. We need to critically question what's going on in our society and what are the implications for now and the implications for the future. So, like I said, we need to stop and think what we're doing and do what's right.
So we've talked about some of the things that have happened in the school setting in regard to these mandates. What is your outlook on the impacts that all of these things are having in society outside of school?
I think people are being harmed by them, like sometimes physically, but a lot psychologically, and people are really turning on each other. So I think I really see society degrading, it's becoming where we turn on people. And like I said, I noticed it in school when one person I practiced with a lot started, on social media making fun of people who had questions about the safety of the vaccine. And the problem is it's not just isolated to healthcare professionals, which is bad enough, but it's in society at large. And I think that's the problem we're in now, is because society accepts what we're doing. But like I said, I've seen there's so much hatred in this society now. And, you hear people's stories are like, for whatever reason, they're not vaxxed. And then they're like, well, you can't see your loved ones, or just when they try to receive health care and they're snubbed. And I can think of one person I know, they're not in the school system anymore, but the vaccine mandates came in, so they took the vaccine and they had a grand mal after the second dose, but they did not disclose it. And the reason being, well, for one thing, they need to keep their job. So they end up just, going for the booster and everything, which is, we know there was a risk for them because they had a history of seizures. They were considered seizure free, but they took the vaccine not for their own health, but not only for the mandates, but because society dictated it. I asked them, why are you doing this? You have risks for taking this product and it's not stopping transmission. So what are you doing? And they're like, my family would disown me if I didn't take the vaccine. And their family is very much like that. The people who don't want to take the vaccine are the most terrible people in the world, hateful, and they're going to kill everybody. And if you don't take the vaccine, you're putting your little kids at risk. Okay. And that's really sad too, because I see people taking it even when they have good reason to say, maybe I should stop and reevaluate this. And it's not happening. So that we're just tearing each other apart, and we think we're being really virtuous. We think if we can post on social media, we've got a Band-Aid on our arm and be like, I've gotten my vaccine, I'm fully vaxxed for the next 3 months. We're really good people. Or if we can post a meme about making fun of people who have some questions about the vaccine, that we're really good people, really doing our part to, get this virus under control. And look at what it's doing in society, not just the students, but as society as a whole. And people are making decisions that are not based on their health and making decisions based on fear. That's not okay. And I was taught as a healthcare professional that, that's not how we operate. It's always in the best interest of the patient. And I see it happening to everyone in society. And I'm like, that's not okay, what's happening at the healthcare professional level, but even on a broader level. It's sad.
Mm-hmm.
Yeah, it is. It's okay, growing up in elementary school, I was taught that cyberbullying is bad and you shouldn't do it. But it's no, it's fine, right? Everybody does it. It's you're unvaxxed, and so we can make fun of you. It's fine. That's the exception, right? We're
but it's
totally
different.
allowed to attack you.
It's different.
It's different. It's different because
because yes.
Oh, okay.
It makes it okay.
Okay, so we're
They're
allowed
just trying
to
to
make
help
fun
you
of
out.
them.
They're just trying to help you out, and
Yeah,
they're trying to bully me into making a better decision for my life, right? That's how it works? Okay.
I have a lot of respect for that kind of argument. Ad hominem attacks are the highest level of evidence.
Absolutely. I mean, what are we thinking?
No, seriously, when I went through school, we have our pyramid with our levels of evidence, and randomized controlled trials are at the top, and expert consensus is at the bottom. Actually, now that it's been reversed, and expert consensus is at top, even though we know they're being muzzled. But it almost seems like you have a good argument. You have better evidence than someone who critically looks at the science if you can attack them. You're you're an anti-vaxxer. Or if people say something like, you're misogynist, racist, homophobic, anything they want to accuse you of.
And then there's the opposite. It's oh, well, you don't have a background in healthcare, so what you're saying is not reliable. Except you do have a background in healthcare.
I don't want to look at the evidence, and I'm saying it doesn't add up. Because you said it's your choice about health, about what treatment you want, but you need to have all the evidence available. And they're no, you're insane. I'm no.
You can read.
I can read. And I was taught what a conflict of interest is. And let me tell you, all this thing reeks of conflicts of interest. And the problem is with that is that you're not going to get the information you need to make an informed decision because there's someone else who stands to benefit. And unfortunately, I think that's coming to play with the university mandates too, because they receive funding from pharmaceutical companies. They'll conduct research for them and get paid per participant. So it's in your best interest to keep the pharmaceutical companies funded, right? But then the issue arises that is the university doing it in the students' best interest in terms of their health, or to keep them funded, which is, obviously we understand you want funding, but when we're getting into healthcare, we're normally really careful about conflicts of interest. And here's like just rampant, the study the other day that wasn't actually conducted saying that, if everyone was vaccinated, there'd be a much lower transmission rate. Well, two things. For one thing, the study wasn't conducted with a mathematical model. And it was on all these major news sources, right, about how vax shouldn't mix with unvaxxed. Second problem was the lead authors disclosed ties to both Pfizer and AstraZeneca. So there's a little bit of an issue, I find, when people affiliated with the pharmaceutical companies say that they made a model that predicted that everyone should be vaccinated.
With their product.
Nobody looks at that.
It's just a slight conflict of interest. It's no big deal.
Oh, it's no biggie. They're just trying to take care of you.
Yeah, sure
They're
they
just
are.
looking out for you.
Yeah, they want you to be a better person by being selfless so that they can be selfish and live, their elite lives.
Western is just they're trying really hard to keep you safe and to keep you healthy. They are trying so hard that they would strip you off your professional career.
Yep. That's about it.
In summary.
Yes.
No, like I said, I think maybe some of them do think that we're being safe, although I'm not quite sure how we're safe if they're not sterilizing vaccines. But I think a lot of people just don't think about the implications. They just go along with what seems to be happening in society, and the people who are loudest about it are, the people we think that dictate is actually true, which obviously we know that's not the case. So they're not critically thinking about what they're doing, might have, like I said, some conflicts of interest. So there are all these things coming into play, and it's just, I'm very frustrated, but I don't want to start, there's no point on getting angry about it. You just have to understand why things are working the way they are and just say, you know what, we need to do better. We need to do what's right and go back to the principles that we know about ethics and treating people as you would want to be treated.
Right. It's about starting to live your life the way you normally would have. And that's our key back into the society that we want to be a part of, and society that we did live in and we really enjoyed. Because I think, as tough as the situation is, the one that you're in, the one that we are in, and maybe other people who are watching this, is that they're facing all these challenges, but you got to look at things from the bright side. Challenges are good. The fact that our whole society is going through such a challenge right now is, you could view it as a good thing, because challenges make people grow. It's either people are going to shrink from the challenge and they're going to deflate, or people are going to grow, they're going to become better, they're going to become more wise, they're going to improve their mental health. Can you imagine we're going to get out of the situation in the near future, and we're going to improve society because that's what we're working towards, and it's inevitable that we're going to achieve that. But the people who are staying with us and the people who are going to work towards that goal are the ones who are going to come out with the biggest benefits. And that's what I'm really looking forward to, because that's the society that we all want to be a part of.
Yeah, except they're trying to kick people out of society if we question what's being done. They're kicking people out of spheres of influence, right? That's the thing. You can't go to a university. You can't be a politician. You really can't do anything except stay at home unless you've complied with our vaccine mandate, which is, it's a marker of compliance with the government, I think, and they're the ones for holding, these resources that we want. But it's sad, because that's the thing. They're trying to make sure we have nothing to do with society, no place of influence in the future. And I think that's a little bit disconcerting for me. So I think that's why we really need to fight against it for, the future of society.
Absolutely. We can't allow that to happen, of course.
Yes. So what do you think is the best way to fight against that?
I think we need to be bold, and we need to be confident, and we need to be humble. Like I see a lot of people like on the side of vaccine mandates. They tend to be very bold, but they're not informed, and they can sometimes be verbally abusive. And when I speak about these things, I always want to be above reproach and say, like, look, I've looked at the issue from both sides, and here are the issues I see with it. So I think, I need to be reasonable. I don't want to just look at only science that just fits my agenda. I want to look at it from both points of view and just saying, like, these are the implications of it. So I think being informed, being calm, being respectful is what eventually will make people, realize, maybe what we're all going for. They're basically going after a fad, I think, and we need to say, like, no, we need to be steadfast.
Yeah, I think it becomes particularly complicated if you are arguing something like the vaccines, well, most of the population has already taken it. So if you are trying to convince them that the mandates are bad, even though, like, does it really matter to them? They've already complied. So it's almost like the mandates don't, like, bother them in a sense, right? Because they can get by. They've done what they've been asked to do. So this subject does need to be approached carefully, because otherwise, if you're telling them, oh, you made this bad decision, if you're really harsh about it, it's just going to turn them off. And that's not going to help. It's going to
continue the divide that's happening. And we want to bridge the gap between the people who have decided to make that choice and people who didn't decide to make that choice. But it doesn't help when these individuals who are, like you said, cyberbullying, or they're doing other forms of bullying in order to coerce, so to speak, these people to bring them back on our side, so to speak, right? That's not right. We got to let people do what they want to do and to respect their choices, because if you want to be treated that way, you got to treat other people the same.
Yeah, exactly. Like, I don't have to agree with your choice about vaccines. You don't have to agree with my choice. It's your own body. It's your medical choice, right? So I want to be respectful in that way. And so, like, if we can find common ground, and which unfortunately we're not, but I think some will find it's more like when the mandates come back in the fall, and they'll probably mandate boosters. I think, like, I know a lot of people, like you say, Bethany, they've already complied, so they did what they had to do. But I know there were a lot of people who did what they had to do because they're like, I was going to lose my job. I had children to provide for, and they're not happy with their decision. So I think we are going to be reaching a turning point. People are going to be like, no more. And that's where we need to, find common ground, is saying, you're right, no more. And this needs to be your personal medical choice, not based on coercion, not based on what the government or your school or your employer wants.
Yeah, we've met a lot of people at Change My Mind events who've been like, I'm not taking a third.
Yeah.
So it'll be interesting if they do mandate a third shot, which I'm not really convinced that they will, but if they do, it will be interesting to see if people actually stick to that, or if the pressure gets to them again, or if the cyberbullying gets to them again.
Mm-hmm.
Yeah, I don't know. Like, I know they've only mandated it in healthcare or a number of settings. But the thing is, like, if I go back to Western in the fall and they're like, well, you have to be vaxxed to attend, I'll be like, a lot of people were vaxxed a year ago. We know 6 months out, there's almost nothing left of, like, unfortunately, they're very short-lived in their efficacy, right? So if they say, oh, well, as long as you were double vaxxed a year ago, that doesn't, like, that, like, even the European Medicines Agency saying, oh, well, these shots will have to be an annual thing. And I read a journal article from, like, last spring, like when they were saying, oh, this will only be a 2 and done.
Oh, really? They said that?
Well, no. Originally the government. It was my understanding that you were, once at 2, you were going to be double vaxxed, right? And then that you were done,
right, because that's the fully vaxxed.
Yes.
Yeah, and now, but you start reading the journal articles that were published earlier, and they're like, oh yeah, this will probably be a yearly thing. The pharmaceutical companies are already making boosters. I'm like, you knew that people wouldn't be doubly vaxxed. You knew that this vaccine probably
it was going to be more.
And that obviously we couldn't get the variants, right? So the fact that, well, they lied to us, it makes me upset. But that's the thing. If they don't mandate a third one, then everything kind of falls apart because we know there's no effect, especially now with Omicron. So that's why I'm thinking they're going to mandate a booster to attend university to be considered fully vaxxed. Like I said.
Well, I thought they would do it in like January or February this year. So that's why I'm like, they've put it off a lot longer than I thought that they would. Yeah, but I mean, going back to stuff from like a year and a half ago, like Trudeau ordered enough vaccines for the entire Canadian population to get 11 shots. So, so I did not think it was going to stop at 2.
So we're protected. That's the good thing.
Yeah. We are set for like, is that 11 years or is that like 5.5 years? I guess it depends on.
Those things expire, he does realize, right?
I think the idea was we wanted to make Canada look amazing and donate our extras to countries. Oh yeah, they're vaccinating animals now. Oh man, I didn't calculate the math for the animals. I don't know how many they have. There's a few zoos in Canada. No, I think the idea was for us to be able to donate our extra vaccines to less fortunate countries that couldn't afford them.
So unfortunate countries.
Well, I know there hasn't been a high vaccination rate in Africa, and they haven't been doing too badly, honestly.
Yeah.
But I think, too, they have the younger population. They have greater levels of vitamin D. They have much higher use of the medications that are known to inhibit viral replication. So if we're already on them, we know some of those medications act as a prophylaxis against COVID. So I think there are other reasons why they're not being hit so hard. And I think that's part of the issue, is that we think everything is vaccine. We will save the world if we vaccinate. I'm like, you got to look at all available options. And that's another issue with the vaccine mandates, is that we assume that that's going to save us. And the reality is we need to look at alternative treatments. We need to look at our own health. And that's one of the biggest problems I have too, because I noticed when COVID came out that they weren't telling people to stay healthy. They're like, live in terror inside your houses. Oh no, their fitness, people's fitness. I'm just cringing if this is going on. And like, why don't they tell people to take care of your bodies? Like, we know obesity is a major risk factor for, severe COVID outcomes. So is a lack of vitamin D, vitamin C, and these are all modifiable risk factors. So, we're trying to kind of use like a one shot, well, 2 shots, 3, 4, 5. But we're trying to go just one direction. Say this is going to save you. And in healthcare, we look at all options, say what's best for the patient, and we always inform people. Like even with cardiovascular disease, we talk about physical activity and smoking, and that's and it's like we think it's our duty as healthcare professionals to warn people about those risk factors for them. And suddenly when it comes to COVID, we can't tell people about any modifiable risk factors. I'm like, well, don't you care about people's health? If you are so concerned that COVID is a public health emergency, which it does pose a threat to public health, I'm not denying that. But if you refuse to tell people about what measures they can take to try to reduce their risk of severe outcome from COVID, how concerned are you about their health? You're denying them that information. Yeah,
it's baffling to see.
Like I said, it's not profitable to a lot of the people who have the influence in what's going on. So,
yes, absolutely. Well, there's a lot to look forward to in the future. We're going to see what happens in the fall with the physiotherapy program and what Western decides to do with their vaccination policies. But thank you so much for joining us today and coming on to share your incredible story. And for the rest of our viewers, we'll be in touch soon.